Can you go to the chiropractor too much? Hey folks, I'm Dr. Jeff Williams here with Creekstone in Amarillo, Texas, coming to you again this week, talking about if it's possible to go to the chiropractor too much. I know you have a friend or family member that needs this message, so make sure you help us and help them by sharing this video with them, okay? So let's dive in. I can tell you countless stories here of patients that have come into my office and they're hopeless, they're in despair, yet through the wonders of chiropractic care, they went on to lead very productive and happy, long lives. And they were able to literally add years to their lifetime. And that's about as big and as important as you can get, right? I want to share one story in particular with you to demonstrate what I'm talking about. One patient, we'll call him Earl, okay? He came to see me years ago. He was approaching being elderly, not quite what I would say elderly, but getting there. He already had a lack of capability and a decrease in activity, in his activity level. And so basically, he was an elderly patient without being of that age yet, if that makes sense. He couldn't roll over. He could hardly even lay down on the table, much less be pushed on with any amount of real pressure that you would picture a chiropractor using. He had lost the ability to play horseshoes, which he loved doing. That was something that kind of fed his soul, was playing horseshoes with his family and his buddies. And he couldn't play anymore. Not only that, he couldn't play with his grandkids, and it was beating him up emotionally as well as physically. He was a lifelong smoker, and he was just a sad guy when I met him. He wasn't happy. Earl committed to coming to see me consistently for a couple of months, and the results were pretty eye-opening, even for a young chiropractor that didn't yet really realize how much he could help somebody. Fast forward a couple of years, Earl came to see me consistently for a couple of months, and then quickly we transitioned him into a maintenance or wellness patient. And that just pretty much means that he came to see me whenever he needed me, which turned out to be maybe every 1 to 2 months or so. Earl did beautifully. He started playing cornhole instead of horseshoes. Horseshoes is a little too much for his shoulders, so he switched to cornhole. He started playing the Wii with his grandkids and being active with them. He stopped smoking. He started going for walks, and he started bringing us garden vegetables and showing kindness and love to our staff whenever he showed up. And he was just a ray of sunshine when he would walk into our doors. He went from being in the dumps and unable to take part as a meaningful presence in his life, to being active, fun, and kind to everyone around him. Like I said, he was a ray of sunshine. Earl eventually got older, and ultimately he passed away a few years ago, which honestly was just a terrible day for us when we found out. But one of the last times I saw Earl, he said something to me that it'll stick with me the rest of my life, I think. He said, "You may not realize it, but you saved my life. If I hadn't come to see you when I did, and you hadn't helped me turn things around, I was about to die way back then. I've gotten to live longer than I ever thought I'd be able to." Wow, right? Wow. Now, I don't tell you this story so that anyone will think I'm extra special, right? I would guess most chiropractors have stories like this that they're happy to reminisce about. And patients don't always recognize the role that they play in the scenario. If he hadn't have made the decision to do something and then stick with that decision and then stop smoking, that's a decision he made. And then get active with his grandkids, he made that decision. And all of that good stuff, well, then he wouldn't have seen much improvement, that way either. The patient is usually more to blame than any doctor when they decide they're going to jump in and be a good teammate in the recovery process. Now, Earl and I, we got to be fairly close, so his is always one of my very favorite stories. But trust me when I tell you this, that there's so many more that I could bore you with when you consider I've now been in practice over 23 years, so you can imagine. My whole aim in telling Earl's story here was to demonstrate that chiropractic has the potential to have a truly profound effect on someone's life, on their enjoyment of their life, and on their lifespan in general. Not only that, but it affects the people around them too, right? Relationships are improved when you're able to spend quality, fun time with your loved ones rather than avoiding any activity because you're always in pain or depressed because you can't move very well. And that just makes sense, doesn't it? So back to the original question, can you go to the chiropractor too much? Well, the answer is yes, absolutely you can. There are many thoughts on this, and most of the time they're conflicting between chiropractors. The conflict is going to be due to different styles of practice, different beliefs about the philosophy of what is happening when a chiropractor works on a patient, and different opinions on what a patient should be doing throughout the rest of their lifetimes with regard to chiropractic treatment, especially once they resolve from pain what should be going on. So I'll say this plainly and simply, I don't typically deal in beliefs. I prefer to deal with research, evidence, and experience. All three of those say that yes, you can definitely go too much, and teaching at-home self-management strategies is the way to handle patients in 2021, folks. The first biggest concern for me when it comes to going to a chiropractor too often is instability. Some folks have an incredible range of motion already. Their joints are hypermobile, like rubber band people or something. Most of these patients have a connective tissue disorder called Ehlers-danlos. Every joint in their body, they're usually looser and more mobile than the regular person's joints. If most chiropractors mobilize and loosen joints on a daily basis, well, does it make sense to a stretchy person to go regularly to mobilize their joints when they're already very much mobile and more movable than they should be, really? Research has been pretty clear in suggesting that hypermobile folks do better with stability and stiffening of their joints. Stability is created with strength training and weightlifting activities, not going to the chiropractor and getting mobilized more. These activities tighten the joints and stabilize them rather than mobilizing them. Many hypermobile people went to one chiropractor after another chiropractor and were continually mobilized, but only found improvement when the process was changed, when the thought process and the programming was changed, and we started stiffening the joints instead of mobilizing. These people can definitely go to the chiropractor too much. To find out if you're hypermobile and may have Ehlers-danlos, visit www.ehlers-danlos.com / to find out if you may have Ehlers-danlos, just visit the link below and give it a try yourself. Next, let's discuss self-adjusters. This is the person you see always popping their backs or popping their necks all of the time. And from experience, myself, I can share with you that when a person first starts trying to pop their own neck, it's a bit of a task to accomplish. It's kind of hard to do. Then, as they do it more and more, it gets easier and easier to do, to the point that they only have to turn their head to make it pop. They just go this way and pow. Sometimes any sharp movement will elicit a pop. That is instability. Not only do they start hearing random popping more often, but they also typically start to have more and more discomfort and pain. That's because the instability they've created from self-adjusting allows more movement within the joints. More movement means more rubbing, twisting, and forces, and things like that. All of that leads to more nagging stiffness and chronic pain. In fact, your spine likes stiffness and stability. So when instability is introduced to the smaller spider web of muscles that hold the spinal column so tight, you just loosen those up and loosen them up. Well, the larger postural muscles respond by stiffening in an attempt to compensate for that instability. Essentially, you wind up with a loose spine or a loose back or loose neck that feels stiff. Now let's move that scenario from the realm of a self-adjuster and into the context of a person that goes to the chiropractor 3 times a week for 2 months, or maybe the schedule's once per week for their entire lifetime. So what constitutes too many visits for one person. Well, that's not going to be the same for one person as it is for another, but you get my point here. If the regular person goes all the time and goes consistently, well, there's a good chance they're actually creating or making worse the problems they're trying to get fixed. A good evidence-based, patient-centered chiropractor should know when to mobilize, pop, pop, crack, twist, all that. We should know when to mobilize versus when to stabilize through strength training and weightlifting and exercise. They should be engaging the patient in shorter, effective, and targeted treatment plans built to the patient's specific issue. In addition, your chiropractor should be teaching you at home self-management strategies to control discomfort so that you're more dependent on yourself and you're not dependent long-term on any doctor's office or clinic. That is power to the patients, right? Not only that, but it's also effective for patients. Now, speaking in broad generalities, if a patient is showing no significant improvement after a short trial treatment period of 3 times a week for just a couple of weeks, we either need to change what we're doing or we need to find somebody else that can help. At least that's how I see it. That's what I've seen to be highly effective for my patients through the years, and that's what research and guidelines tell us to do. All right. I hope you enjoyed this video. Again, I'm Dr. Jeff Williams with Creekstone in Amarillo, Texas. If you're watching on YouTube, please subscribe, comment, and share. If you're on Facebook, like, comment, and share. People in your network could use this information. It's the way of social media, folks. If you're from the Amarillo area or you're going to be passing through and you need to be seen, please call us at 806-355-3000. Let the staff get you set up on our schedule. Until next week, be good. Take care of yourselves. We'll see you then.